This conference will now be recorded.
Deb, do you want to start right at the hour? You want to start right at the hour, or do you want to wait a couple more minutes? Up to you.
Let's just wait one more minute right till the 1:30 mark, and then we'll get started.
Okay, sounds good.
Looks like we got a few more people joining us here.
Mm-hmm. Yep.
All right, well, I think we can go ahead and get started, Alyssa,
Okay.
if that's good. So welcome, everyone. This is Deb, and I help coordinate our library group here at the Academic Collaborative for Integrative Health. Thanks for joining me today. I really appreciate it. And we have with us Alyssa, who is our new executive director, and she'll be talking to us in a little bit. But in the first part here, I just wanted to go around and maybe introduce yourself briefly, say where you're from. We do have a new group member today, Natalia from CMCC. And maybe we'll start with you if you would be able to introduce yourself and just give us a little brief history of your position. Probably everybody's on mute.
Trying to see if
I see her there. All right, well, we can start with, let's see, anybody else? So I'll go down the list here. So Anne?
Yes, here.
Awesome. Can you just introduce yourself? Because I know Alyssa's new to our group here, and I wanted to make sure that she's aware and gets a voice recognition on everybody on the call.
Sure. I'm Ann Macaras, Director of Library Services at Northwestern Health Sciences University.
Thank you.
Awesome. And Deborah, I saw you were on earlier.
Yeah.
Okay. Oh, okay. I see she doesn't have a mic. Okay. So she's in the chat section with us today. She's at the University of Bridgeport.
Sorry, hello. We just joined. I don't know if you can hear us. This is Natalia Toccarelli from CMCC. And
hi, Natalia. Yes, good. We can hear you. Thanks for joining.
Okay. Thank you.
And Natalia, you are new to our group today. And maybe you could tell us a little bit about when you started and your background a little bit.
Yes, I just joined. Just a second. I'm trying to let me.
Sounds like we might have lost her there. All right. I see that Jane is on. Jane Saxon. Hello. Hi, Jane.
Hello.
There you go.
Hello. Hi.
Hi, we can hear you. How are you?
I'm good. How are you guys?
Good. Thank you. Thanks for joining the call.
Sure.
You are with which organization?
Oh, me? Library director at Bastyr University.
Wonderful. Okay, thanks.
Sure.
All right. I see Krista is on.
Yes, I'm here. Just muted.
Awesome. And I see Michael is with Natalia. Olivia, you're here as well?
Yes, I'm here. Olivia Baldwin from Pacific College of Oriental Medicine, Chicago's campus.
Great. Welcome. Nice to meet you.
We have Patricia.
Yes. Yes, I'm the Dean of Libraries at Pacific College of Oriental Medicine. I just started in March, and my background is in public libraries. So this is a first for me, and I'm interested to see what you have to say.
Oh, welcome. Good to meet you.
Great.
Problems here, but now we are good. Sorry for interrupting you.
Wonderful. Welcome back. I'm glad that we got you connected again.
Thank you. So, yes, maybe just a very brief introduction. I'm a new library director for CMCC. I joined the organization back in July. So, and excited about my new role, and I'm new to chiropractic world. So I'm exploring it right now, and I look forward to meeting you all in person at one point, probably in the future conferences.
That would be great. Awesome. Well, welcome. Who else do I see? I see Susan Banks.
Yes, hi. Can you hear me?
Yep, we can hear you. Great.
Oh, great. Susan Banks, Bastyr University, senior librarian. Been here since 2000. Work with Jane Sexton and Ekaterina Papadopoulou.
And Ekaterina, you are on as well, too, right?
She might be. She's having technical difficulties. She is, pardon me, senior librarian. Has been here 3 years. I think she's able to see the presentation, but for some reason doesn't have the audio to her mic.
Awesome. And then, oh yeah, I see her chat. Her mic is acting up. And Svetlana, do you have a mic? Or I see you in the chat there. From Pacific College in New York, PCOM, which is great. Oh, I didn't realize. I see that Michael has said that. Oh, I'm sorry. You are from the Canadian College of Naturopathic Medicine and also joining us. Welcome. And Svetlana says that her mic seems to not be working. But so is there anybody else that I missed? Oh, Kathleen Smith. Awesome.
Oh, good. All right.
Anyone else that I missed today?
Hi, I'm Sally Harvey from the Southwest College of Naturopathic Medicine.
Wonderful.
Great. Hi, Sally. Hi, Kathleen, and welcome all.
Okay, great. If anyone else joins us, hopefully they'll be able to get into the chat, or we'll give another introduction or shout out. So I wanted to turn the conversation over to Alyssa at this point. I'll let you introduce yourself and give us a little update on the organization.
Okay, great. Yes. Again, welcome everyone. Thank you, Deb. My name is Alyssa Wistrel. I'm the fairly new executive director with ACIH, or the Collaborative. I joined in April, and following my predecessor, Liza Goldblatt, very big shoes to fill. So I appreciate you all convening today, and Deb for doing the introductory round. We are looking forward to doing a quick overview here of the Collaborative. For just to refresh those of you who are familiar with us, we're going to do a couple slides on our vision and our mission and our organizational structure, which will, of course, help inform our callers who are new to us today as an organization. So let's see. So we are a 501c3. We're a nonprofit, of course. We were formerly known as ACAC, and our new acronym for the past 2.5 years or so is the Academic Collaborative for Integrative Health, or ACIH. We focus on educating, collaborating, and advocating for the inclusion of the values, practices, and disciplines associated with integrative health and medicine. And we do that through our membership. So we are a consortium of organizational and associate members, and our organizational or core membership is the councils of colleges, the accrediting agencies, and the certification and testing organizations that are associated with integrative health and medicine fields. So for us, that's defined as those 5 professions that have a U.S. Department of Education recognized accrediting agency: acupuncture, chiropractic, massage therapy, naturopathic medicine, and direct entry midwifery. And we also have a traditional world medicine emerging professions group or member group. And in that, under that category, we have yoga therapy, Ayurvedic medicine, homeopathy, somatic movement, and nutritional therapy included under our TWM EP group. We also have 30 individual colleges, universities, and schools, which are some of which are represented on the call today. And in addition, we have 15 associate organizations. So we're looking to grow our individual colleges, universities, and schools category in the years ahead, and bring more schools into our consortium to have more of a unified voice amongst the profession. So we are working on that. And we look to keep our core members, the councils of colleges, et cetera, stable so that we have a unified voice and seat at the table in those arenas where our voice really matters and really counts. So that's a little bit of history there. So I already read our mission, and just to reiterate, we do focus on educating the public about the disciplines that we represent and their benefits for patient-centered care, and on advocating, of course, for collaborative, team-based, patient-centered care. And we are, of course, envisioning a system that can deliver effective care that is patient-centered, focused on health and well-being, and is readily accessible to all populations. So here's our alphabet soup of acronyms of our various organizational members, the top being our core membership that I mentioned. Then we have our TWM and emerging professions. You may or may not recognize some of these acronyms, but that is who is represented here. And then our individual colleges and our associate members, which includes individuals. And we do have individuals join us, and we welcome that. And they also are privy to a number of benefits that our other members have. However, just structurally, the core membership that I mentioned, the 18, the way that we're structured as a board is the 18 core members have representatives who sit on our board. So our board meets quarterly, and one of those meetings is an in-person strategy meeting. We have that coming up in June 2019 next. And in that way, all the core members are able to convene and keep an eye on our project progress and have a voice, a collective unified voice in conjunction with external projects that we're doing, which I'm going to talk about in just a couple slides. And also let us know what is important to their professions so that we can be relevant to them as an organization in advocating for their own professional pathway that they're working on behalf of the disciplines that they represent. So Kathleen Smith is on the call. Hi, Kathleen. She's the executive director of the Learning Resource Center at SCU, the Southern California University for Health Sciences. And I have the slide in here because ACIH now has a home at SCU, and we have a physical office there. And that gives me the opportunity. I go in once or twice a week when I'm in the Los Angeles area. I live in LA. Sometimes I'm on the road. I'm on the road right now. But when I'm in town, I go to SCU once or twice a week. And it gives me an opportunity to interface with the faculty, the administration, the students. John Scaringe, who's the president of SCU, is a member. He sits on our board in the executive committee. He's currently the treasurer. He's been a longtime member of the board, as has SCU. SCU is one of our leading school members at the what we call the chancellor level, and they're very involved in the work that we do, as are many of our other member schools, and we greatly appreciate all of our member schools and everyone that is representing schools who are on the call, of which we have great involvement on a board level as well represented. I'm not going to go through everyone, but really I think everyone that is on the call does have deep involvement with our organization in terms of the schools, whether on working groups, through our projects, or represented by a board member. So anyway, the office that we now have at SCU is a great gift to, oh, sorry, that's me, hang on, let's back up.
You have reached 978-283-2160.
Oh goodness, sorry guys. I'm gonna try and get out of this space here. I couldn't turn that off, and it's kind of like an answering machine. Okay, sorry for that disruption. Anyway, SCU is sort of our is providing resources for us, and in terms of this call, sorry, I just got a little off track with that phone ringing, but in terms of this call in our special, our SPIG, our library SPIG, I have had the opportunity to connect with Kathleen Smith, and I anticipate that Kathleen and I will be able to do more work together on various projects, time permitting and resources permitting as well. So let's move ahead. So on this slide, Deb Hill and Beth Rosenthal, who's joined us, who is our Director of Working Groups, is going to speak a little bit to why we have our slide up about our CEDR, our Clinicians and Educators Desk Reference Book. Many of you are familiar with this, and for those of you who are not, this is a publication that we're in our 3rd edition for, and it is our desk reference on the integrative health and medicine professions. It is available in print and in EPUB and also in Kindle formats. And we have a project that we're launching now to increase the dissemination of the CEDR. So I'm going to invite Deb to speak to this, and then Beth.
Thanks, Alyssa. Actually, I think Beth might go ahead with this and the lead, because she has been so involved with this project, and actually the writing of the desk reference as well. So Beth, if you want to say a few words about it and maybe where we're headed with that, we can take it from there.
Okay, thanks Deb, thanks Alyssa, and hello everybody. So I'm just curious if you want to put in the chat, if you're able to, how many of you are familiar with the Clinicians and Educators Desk Reference, which is a resource that, while we compiled it, it was written by, oh good, starting to see in the text, very good, written by vetted experts from the authors and editors were nominated by the councils of colleges in most cases, or a national organization representing your disciplines. And Deb and I talked briefly before the call today in really what we wanted to share with you is that it used to be available only in print format, and our feedback was that schools were eager to use it in their courses textbooks, but students already had to buy so many textbooks, and could we do something to make it more available? And that's when we took the step of creating a free downloadable PDF. And as Deb mentioned, we really want to be able to get this in the hands of more people who will be able to use it, your students, your communities, your faculty. And we heard from a librarian who informed us, because you guys know a lot more about these things, many of these things, than we do, that the CEDR was not discoverable, and I'm looking for the exact words that that's used, that it was not picked up by Google, and that it was not discoverable online. And it was suggested to us that one way to make our free downloadable PDF, CDR, more discoverable would be to make it available in online repositories as well as individual school repositories. This is really unfamiliar territory for me and maybe for Deb and Alyssa. And so in our endeavor to make this resource, and there are many other collaborative resources which could be of value to your students in your community, but right now we're just focused on the CDR. It would be very helpful to us to understand, it's the Creative Commons license, which is my understanding of what we need to do as a first step to make it more discoverable and more available. And that's something that we're hoping you have understanding of, familiarity with, and might be able to help us understand and decide on the appropriate Creative Commons license for the free version, so we would be able to get it out to even more people in your community. I'll pause there.
And actually, Alyssa, if you can go ahead and flip up to the next slide. I think this might give you an idea of, I think, where some of our sticking points are. As Beth said, I don't have expertise in copyright, and this is what's currently on our free PDF version, which is copyrighted. So to my understanding, we can't put that out in the Creative Commons area. And so this will then limit us on the exposure and making sure that this is really something that can be utilized by your students and is easy for everybody to use. So I welcome any kind of feedback or discussion on this that you all might have, or thoughts on how to make this book more readily available for your students and for your population. So I'll open it up.
Sorry, this is Krista Jacobson.
Awesome.
So it's copyrighted, but who wants the copyright of all the what's written? Did we get copyright from the authors? Just because copyright, it has copyright on it, it doesn't. If we own the copyright on it, or whoever owns the copyright on it can do whatever they want with it. So if they want to put it out there, they want to put a Creative Commons license on it, they can. All the copyright says is that you reserve the right to then determine how it's used.
Oh, great.
Yeah, that
was simple.
Yeah, as far as I know, we just put the copyright on it. I'm the one that worked very closely coordinating all the efforts of the authors and the editors, and we never gave them anything to sign or copyright, so I do believe the organization holds it.
Okay, so we can take this offline. I'm in a copyright course right now, actually, so we're kind of there are all of these sorts of little things with copyright, but obviously, yeah, I mean, just the fact that it says copyright does not mean anything in terms of distribution. So, yeah, we can talk about that later if you want to talk about offline. But
I
I'm not a
wanted
lawyer.
to mention, this is Pat. I wanted to mention that I just Googled this book, and it took me to the integrativehealth.org site where there is a link to download it in PDF free.
That's good. That's very good. Thanks for testing that out.
Yeah, so I'm not sure how much more you need to do since it came right up in a Google search.
Well, for one thing, people ask us if they can use part of it, and we don't know about granting them permissions, and I don't know how many people aren't approaching us because it says no part of this publication may be reproduced, et cetera, et cetera. Would that be something that would hinder use of it, or having it in a repository in your own school?
This is Kathleen at SCU. I think this might be something to have a small discussion about offline, because even on the individual chapters, if they've got named authors on them, you need to get them to surrender their copyright rights. And like R2 or JSTOR, or I'm seeing the suggestions in the chat. Yeah. They're all good suggestions, but you have to get the copyright to all of the parts of it as well.
Right.
You're right. That does sound like probably maybe a little deeper conversation offline. If there's a couple folks that would be interested, you know, and having that conversation, feel free to
That would
email
be
me.
really helpful.
And then we can get together a smaller group and discuss it more in depth. But one thing we do want to make go ahead.
What's the email address that we should email to?
Oh, it's me. It's Deb Hill. It's D.
Hill. Okay, I wasn't sure.
Yeah, it's the one where the meeting notices are coming out. You should be able to reply to me. It's dhill@integrativehealth.org. And I'm happy to help coordinate that. And, you know, we'll take any other suggestions that anybody has, or if you think of something, and you can go ahead and email me. But the one reason we want to bring this out today is to make sure that everybody is aware of this resource, and it is free. And then if there's anything that we can do to make this easier to integrate it into your collection, so that your students have more access to it. If that PDF file is fine and you're able to put that into your collection and make it freely available, that's wonderful. Or if there's something else that we can do to help you get this out to your students.
Thanks, Deb. I just advanced the slide. I'm just going to take you back for a little bit for a refresher on what ACIH, the collaborative, is involved in with a couple external projects. And then I'm going to share a few slides about a new resource that's come to our attention about a virtual library that is spanning the Americas. So that's coming up. In the meantime, I'm going to give you just a snapshot of a couple things that we're involved in. Those of you that are familiar with us probably know that we've been engaged with the National Academy of Medicine's Global Forum for Innovations in Health Professional Education. So as an organization that focuses on interprofessional education and interprofessional care and building bridges between our professions and mainstream systems and mainstream settings with MDs, DOs, et cetera, this venue, the Global Forum, has given us a lot of access in that regard and a really important seat at the table as a member of this group. This group is convenes a couple times a year and is based out of Washington, D.C. It has over 60 members, as I understand it now. And really, we are the only organization that represents integrative health and the practice of integrative health in medicine at the table. So over the years, the opportunity to be there and be involved in planning workshops, for instance, that are of relevance to our professions and also introducing those professions in terms of through the lens of interprofessional education to these other organizations. I mean, just to give you an idea, on the list of members of the Global Forum that we participate with, the American Medical Association is there, the Nursing Association, Physical Therapy Association, National Physical Therapy Association, Occupational Therapy, and so on, and then associated types of groups. So we've made a lot of headway being a member of the Global Forum. We're represented by Eliza Goldblatt, who's now a member of our board, and David O'Brien, who's currently our chair. And David O'Brien lives in DC. And we were able to have a role on the planning committee for this workshop that happened in April, right when I came on board. And these workshops are usually 2 days, and they're free to the public through their membership, and they're free to register at for their live webcast. And then they're always archived. They're archived on our site at integrativehealth.org, and they're archived at the Global Forum site, so they can be accessed after the event. And in this particular workshop, we're focused on resilience, health, and well-being, and how to institutionally address stress and burnout, which is so critical for all of our professions, all of our medical and health, integrative health practitioners around, across the board. So that was a very successful and well-attended workshop and very relevant topic. And what we're able to do by being a member of the planning committee is to introduce speakers that represent our disciplines and professions, and to just bring in, our perspective and our paradigm to the dialogue. So we're also fortunate to be a member of the planning committee for an upcoming workshop, also in DC, the non-pharmacological treatment of chronic pain. And again, Liza Goldblatt is representing us on the planning committee. And we've placed several speakers thus far. And we can, if you're on our collaborator, our quarterly newsletter list, then if you subscribe to that, then we'll be sending updates to that list about this workshop and how to register for it. It also was in the recent collaborator. I'm pretty sure I'm correct about that. That we had some registration information there. So the other project I wanted to let you know about is that we're working with the Academic Consortium for Integrative Medicine and Health, otherwise known as the Consortium, which for those of you who are unfamiliar with this group is a consortium of schools with academic medical centers related to or focused on integrative health. Universities and colleges, there are, I think, 72 members under their consortium umbrella that represent, that sector. And so we have a project that we're working on to develop a 36-hour hybrid course. And this is, again, about interprofessional education. And in this case, it's about training our disciplines, the last year students, residents, and practitioners to work in integrative, conventional medical in and outpatient settings. So the way that this course is going to be structured will include a training component in interprofessional education and patient care for all of the health professionals who work in these settings. And there'll be 30 hours online, which George Washington University is taking on the online platform piece, and then 6 hours in person, which will take place at these various integrative clinics as that are members of the consortium. So that takes me to, that's just a little snapshot of what we're up to among other things, but now we wanted to kind of get to this interesting aspect of this virtual health library, or VHL, TCIM, for traditional complementary and integrative medicine. You can see PAHO, or Pan American Health Organization, and the World Health Organization, along with BARIM. I'm not sure if I'm saying that acronym correctly, but they are the Latin American and Caribbean Center on Health Sciences Information. This is a new site, a very deep, I had a presentation on this by a couple people who are behind this virtual library, and it was just maybe a couple months ago, so I borrowed I took screenshots of the slides, which is how I've got them in this slide deck. And they're live, but they're still working on components of their system. And so Deb Hill would like to have this be part of our presentation to you and dialogue with you in March 2019. So I'm going to skip through a couple slides here and give you a picture, and then we could I'll turn it back to Deb, and we can see if we just have a moment for some input from you all about this virtual health library. So here you see the URL, mtci.bvsalud.org, and you can see the components down on the bottom of the slide: health strengthening, healthcare models, and TCIM approaches, what we might call health creation, I suppose, or health promotion, understanding TCIM, grouping the concepts, models, evidence, dossiers, and terminology on TCIM, strengthening research, which we're working steadily toward to build bridges for our research capacity, resources for capacity development, and conceptual models, understanding diverse paradigms, developing new concepts. And so this is to be a collaborative and participative virtual space. And they have a facilitator in PAHO, WHO, and BARIM, and will apply the virtual health library model of network collaboration. And then I have one more slide with the objective, and I'm just going to read this, to promote the visibility, access, use, and generation of scientific, technical, and educational contents that contribute to the promotion, development, and integration of the TCIM and health services and systems in the Americas region through the collaboration of stakeholders. So in the presentation that I was part of, and Beth, I think Beth Rosenthal is on the call with us now, you were on the call with us, Beth. So my sense was that it wasn't really clear yet because they were still in the process of building out their site and bringing in more components, what our next steps might be or how we can be most helpful in terms of the collaboration. We're definitely a stakeholder, but how can we be engaged? I'm hoping that when we have a presentation from the principals of this virtual health library in March, that Deb has on her calendar for all of us, that we'll have more input from them about how they'd like us to be involved. So I'll just leave it at that and turn it over to Beth and Deb and all of you for any sort of comment or anything this might bring up of interest.
Beth, did you have any?
Thanks, Alyssa. I did. Yeah. Thank you so much. I wanted to mention two things. One is that when Alyssa and I were briefed on PAHO, one of the main people who's involved who spoke with us, his name is Daniel Gallego Perez. And I'm currently at the American Public Health Association conference, which happens to be in San Diego this year. And I've been with Daniel, and he's the chair-elect. So I think maybe at the end of this meeting or sometime pretty soon, he will actually be the chair for the American Public Health Association section, which is called Integrative Complementary Traditional Health Practices. It's a long name. And I mention that because it's even more opportunities for collaboration. My recollection, Alyssa, is that he did give us some guidelines about what would be involved for us to be actually collaborating partners, but it wasn't really clear. And I think that the March talk would be a really great opportunity to get more clarity on that, and then to bring it to our board as well as our wonderful library SPIG here, and to see how we might get more involved. The other thing I wanted to mention really quickly is because I think this audience might be interested, we're having an Integrative Clinics webinar tomorrow. This will be the 7th in our series. It's happening at 10 a.m. Pacific time, and we're featuring Justin Gould, who's from the Dartmouth-Hitchcock Medical Center. These webinars are free. They're open to all of you, to your population, your students, your community. And Deb, perhaps I could send the little blurb out, and you can send it out to this mailing list again, just in case anybody's interested. And if it's something you aren't able to attend because of the short notice, but you are interested, as Alyssa mentioned, if you're not already signed up to receive our collaborator newsletter, there's a subscribe button on our website. Please visit it, sign up for it, and then you'll get more advanced notice of these kinds of webinars that we have that are open to you and your students, to the public, and they could be quite interesting. And we're also always interested in learning about presentations that you would like to hear more of. So I'll stop there. If there's any questions, please let me know.
This is Deb. I know that one part of their virtual health library is building out of an area where for free, or I should say not free, well actually yeah, free access to different journals, but they're also doing, to my understanding, compiling some of the gray literature, which is always a wonderful thing to have compiled into one location. So I would welcome if any of you have questions, or if you've heard of it or have been to their site, if you could let me know, that would be great, or we could discuss it and see what you all think. But I think it should be hopefully a good presentation come March. We'll get some more in-depth knowledge about the health library that they're building out. So does anybody have any comments on that?
I haven't seen it enough to have a comment.
That's one reason I kind of wanted to bring it out today. At least it'll give you some time to poke around, before we go right into a meeting, and then we'll have a lot of questions. And hopefully, I think they're continuing to build up the site. But from what I've seen, it's a pretty robust effort.
Deb?
Yep.
I have a comment. It's Jane Saxton from Bastyr.
Awesome.
I would just like to thank the people who are involved in this endeavor because bringing people together in this way seems to me such a positive move in kind of dark times, if I can say. And I just really love the idea.
Awesome. I think the more that we can, you all are experts at sharing information, but definitely anywhere that we can get more open access to different journals and have things compiled in a more systematic way, I think will be helpful. So, does anybody else have any other comments? What I can do is go ahead. I'll send out a follow-up email in the next day or so with. Oh, actually, I'll send out a follow-up email today, Beth, with the link for the webinar tomorrow that Beth spoke about. Also a link to subscribe to our newsletter, a link to our free downloadable CEDR, and then also to their website as well. So with that, I think that comes to the end of our conversation today, unless anybody else has anything else that they would like to add or any other questions.
Great. Okay, well, this is Alyssa again, and I just want to thank you all for your time and your input, and especially to Deb Hill for organizing this, and to Beth Rosenthal for joining us, and all of your to all of you for taking the time to participate. And we look forward to a more robust discussion in March. So you'll be hearing from Deb and from myself as we organize that, and that will be focused solely on the virtual health library, and will probably be a longer call, but not more than an hour, and we'll try and leave time for Q&A on that call. So anything else, Deb?
Nope. I do want to thank everyone as well for your time today. And please, if you have any questions or if there's anything that that you wanted to review from today, feel free to email me at any point.
Thanks, Deb.
All right. Thanks, everyone.
Bye.
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 Bye. I passed speaker. I was on a conference call with HLA, and they didn't hear me. Yeah, I don't know. Okay.
Deb, are you still there?